and welcome to the San Francisco Interfaith Council online briefing for faith leaders. Today's topic, the challenges of death in these times of COVID-19. Our guest speaker today is Rand Miyashiro, the IT project manager for the City and County of San Francisco. This event is hosted by the San Francisco Interfaith Council and supported by the Joint Information Center of the San Francisco COVID Command Center. Today's presentation, the audio, video, and chat will be monitored and recorded for record keeping, training, and quality assurance. By default, all participants will be muted and video turned off to minimize distractions. To submit a question or comment, please select the chat button at the bottom of the screen and send a message to Q&A. They will be collected and shared with the Interfaith Council at the end of the meeting for a response. Finally, a reminder to get tested, San Francisco. Anyone who lives and works in the city of San Francisco can help stop the spread of COVID-19 by scheduling an appointment to get tested for COVID. You can visit sf.gov, get tested SF, or simply call 311. Once again, welcome to the San Francisco Interfaith Council online briefing for faith leaders. And I will now hand it over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas.
Lynn, thank you so much. And thank you to our wonderful tech team for all of the support that you've given us over these past many weeks and months. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this morning's online briefing for faith leaders. If the pandemic has taught us anything, it is that the coronavirus has indiscriminately impacted every sector of society and life as we once knew it. One particular human experience that's been profoundly disrupted has been the death and grieving of loved ones. Protective precautions have not only precluded family members from being at their loved one's sides at the time of death, but also created distinct challenges to the customary funeral rites so integral to the healthy grief process. Joining us this week to shine a light on both the technical as well as pastoral challenges of death in these times of the coronavirus is the former medical examiner liaison to the Department of Public Health's COVID-19 medical branch, Rand Miyashiro, and representatives of the religious and funeral-related services. This weekly online briefing for faith leaders is hosted by the San Francisco Interfaith Council and supported by the Joint Information Center, COVID Command Center's Joint Information Center virtual outreach team. And now, without further ado, allow me to welcome the Chairman of the Board of the San Francisco Interfaith Council, Kaushik Roy.
Thank you, Michael. Good morning, everybody. On behalf of the board, it is my privilege and pleasure to welcome you to this morning's conversation. The Interfaith Council is very honored to be able to host these weekly conversations. And as Michael mentioned, today's topic is one that under normal circumstances, most of us try not to think about, but certainly is unavoidable in a post-COVID world. So I want to thank Rand and our panelists for joining us. If you are joining us for the very first time at the beginning of every Interfaith Council meeting or gathering, there's an interfaith statement that we like to read. So I'll just read that now and we'll get going. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other that we might better understand the multiplicity of faith traditions in our city and in our world. Good morning, everyone.
Thank you, Kaushik, and thank you for your leadership and constant support. It's wonderful to have you with us every week. We also now would like to ground us in a meditative moment and welcome former member of the Board of Directors of the San Francisco Interfaith Council, dear colleague and friend, Sister Sukanya Belsari of the Brahma Kumari's Meditation Center.
Thank you, Michael. Good morning, everyone. The topic today is a very close one to my heart. During this pandemic, in the month of April, we witnessed the passing away of our spiritual head, Dadi Janki. And we were all sitting in our home. I was stuck in lockdown in India, and we were watching the funeral attended by just a handful on TV. It was a very, very interesting moment, very profound because she was deeply spiritual, a spiritual powerhead. But it was we were missing something. All of us, all over the world, we were missing something. And so I bring that experience into this meditation today. Wherever you are seated, I invite you to sit very, very comfortable, very comfortable. You are with yourself, as we are always on this journey of life and beyond. We are with each other, but we are traveling on our own on this journey of life. Ask yourself, who am I that is traveling? Who am I? Take a deep breath. Let it go. Ask yourself, who is this real I that is living this life moment by moment, living every situation moment by moment? Who am I? I, the self, is that pure inner light in this physical body. I am a spiritual being expressing my spiritual qualities through my actions, giving an earthly experience, an earthly spiritual experience to everyone around me. Let me bring my awareness to that inner light at the third eye location. In the center of the forehead, I, the consciousness, the pure awareness, life force, I am seated on this throne of my forehead, just a bit inside. I am living this life. I am a spiritual energy in this physical body. Take a moment and get in touch with that pure inner light that you are at the core. Visualize that radiance, that peaceful, powerful, pure radiance of light that you are. This radiance of light is beyond the color of the body, the nationality of the body, all the differences and opinions we hold. This inner pure light that I am right now, at my purest inner core, I am beyond all of this. Just see yourself as this radiance of peace, shining over the whole world. Radiance of pure energy, shining over the whole world. Radiance of strength, shining over the whole world. This is I, the self. This is each person I look at. Every being is that radiance, that inner radiance of peace, of light, of pure energy. Each and every being, my sibling, my spiritual sibling, children of the one supreme light, Supreme Father, Supreme Mother. We come from that one abode of light, our supreme abode. We play our part. We share our experiences, expressions of our pure energy on this earth. And one day we return back to our sweet home, the abode of light. I remind myself of this journey. I come from that abode of peace, abode of light, abode of pure vibration. I spread peace, pure energy through my actions, through my earthly roles. And I return back to my abode of light, abode of pure energy, to my most beloved Supreme Parent, to be filled once again with that abundance of peace, abundance of purity and strength, to return back to play my roles once again. Just absorb these words, absorb the pure energy that you are. Absorb deeply the purest love of our Supreme Parent, Supreme Light, the one who loves me the most dearly. And with this awareness, pure energy, pure awareness, I, the self, and so are others. Pure light, pure radiance, pure energy. Each one is a spiritual light force. I hold myself and everyone in high regard. Get in touch with your breath. Breathe in, breathe out. Take a deep breath. Let it out. As you once again open your eyes, get in touch with this world of action, world of movement, world of your roles and responsibilities. Step into this world as that inner radiance and express your purest of pure energy. Om Shanti, Shanti, Shanti. I am peace, and so are you. Om Shanti. Thank you.
Om Shanti.
Shanti.
Thank you, Sister Sukanya. In these times of stress and isolation, you have helped to bring to us connectivity and peace as we attempt right now to address a subject of great mystery and in many cases, great pain. So we thank you. We have a unique opportunity, dear friends, to look into a window that is a mystery to us in this time of the COVID-19. This pandemic, the greatest fear is that of death, and the opportunity to express love to for our loved ones who are in pain and suffering and dying is being taken from us because of the precautions that are so necessary. Today, we are very blessed to have with us the IT project manager for the City and County of San Francisco, Rand Miyashiro, who is going to share with us some of the things that we ought to know. And we're also looking to Rand as well as to our panelists to give us some guidance on how we should proceed and what we can expect in the event that we lose a loved one during this pandemic. So without further ado, Rand, the floor is yours. We are grateful for your presence here. Your bio is very impressive, and I would direct folks to go to the program announcement to see that. But out of sensitivity to time, we would like to give you the floor.
Thank you, Michael. Good morning, everyone. Welcome to the presentation on the recent San Francisco Department of Public Health order requiring testing of deceased persons in San Francisco. By attending this talk, I hope you will be better informed about the decedent testing requirements that may affect San Francisco families who lose a family member. I'm hoping that we are able to present the slides at this point. And let's go on to slide 2. There are 4 parts to this talk. First, I'm going to talk about the main points of the order itself and the who, what, when, where, and why of the order. This includes the city and the private entities who are carrying out the order and its impact on families. Thirdly, how do families and their spiritual advisors and funeral homes comply with the order? That's actually the shortest part of the talk. And then further reading about this order. So on the next slide, we can see that the health order has a name, C-1914. It was issued at the end of June, and it's been effective for over a month now. As far as I or my DPH colleagues know, this is the first county order in the United States to mandate that all decedents in the county have evidence of a recent COVID-19 test or otherwise be tested by the discharging hospital, skilled nursing facility, the decedent testing unit, or the medical examiner. The audience might have noticed that there are some exceptions. I just want to mention one in order. There is a federal hospital, the VA hospital. They're not bound by the city ordinance, but I know they're following the order, which is voluntary for them. On the next slide, let's talk about who is being tested. This talk is concerned about decedents who are being tested, and those are decedents without a history of a COVID-19 test within the last 14 days if they had a positive test, or the final 72 hours of life if they had a negative test. If there's no record of testing at death, then they must be tested after. For those decedents passing away outside of a hospital or skilled nursing facility, the Public Health Decedent Testing Unit, which I'll call the DTU, and the medical examiners are the ones carrying out the testing. So those are the parties who are carrying out the testing, but I do want to mention the funeral establishments are involved and checking the test status. They're making test appointments. In some cases, they're offering their own facilities for the place of testing. And I also want to mention the public health lab, which is carrying out the tests and which is tireless in trying to turn those tests around as quickly as possible. And the case of positive tests especially, they want to get that out to the families, the affected parties, and by state law, they have to report that to the state within an hour. On the next slide, you can see the most common case outcome for decedent testing would be to call the DTU unit, which is a unit of emergency services in the city of San Francisco. And they're the ones that are collecting these specimens in most cases. In something less than a quarter of deaths in the city, the chief medical examiner will take the case and produce a test sample at their own facility. So let's talk about what's being done. This is a nasal swab COVID-19 test that's taken from that part of the body with a Q-tip type device and sent to the public health lab. They are using the most reliable test. It's called RT-PCR, and it takes longer than some of the quick 15-minute tests you've heard about, but it is more reliable. It's the most reliable test we have at this point, although not 100% foolproof. By health order, the families may not be billed for this test. On the next slide, shows that the results might be available 2 to 6 days later, and the medical examiner, if they're handling the case, will notify next of kin or families of positive results. The DTU will also do the same, positive results only, as well as contact 911 providers and others who are on the scene, such as funeral establishment providers or police. The positive results, about previous slide, please. Thank you. The results are also used by the Department of Public Health contact tracing to follow up with anyone who might have been present near the time of death, such as family members, of course, friends, and others, so that the city can track down all sources of COVID-19 among the living. So where is this test done? Generally, if it's done while the person who's living, of course, it's a hospital, skilled nursing facility. When the person becomes a decedent, it's also possible they may be tested there. But if it's at a home or other locations, it's likely that the DTU is going to perform the test at the place of death, which is typically the home, a hospice, or as we're finding out from the recent institution of the program, at a local funeral establishment. For medical examiner cases, the test sample is collected at the facility, and families and funeral establishments are never directly involved with the actual test sample collection, the order write-up, or processing. So when is this happening? The health order states the test must be conducted within 72 hours of death, That's following the Federal Center for Disease Control, or CDC, guidelines about collection of these specimens. Both the DTU and the medical examiner try to obtain the sample the same day that they receive the death notification. And I just want to mention that the DTU unit is based in Bill Graham currently, and they dispatch ambulances from 7 a.m. to 9 p.m. If there's a call after 9 p.m., they'll take the call and schedule that for the next morning. And that's where funeral establishments really come into play, because they can offer their own facilities if they're local for testing, or of course the DTU would go to the residence if the decedent is there. Why are we doing this? The best explanation is the most technical explanation. For those of you who want to delve into this, I encourage you to read the text of the health order. In the middle of the health order, after the popular explanation, it goes into Article 1, and there's 4 parts to why we're doing this. The intent is, first, to increase opportunities for detecting the COVID-2 infection and notifying post-mortem healthcare workers. That is, of course, funeral establishments, EMS, medical examiner, others who are handling the body at that point. Second, to grow the epidemiological monitoring capacity of the city in relation to SARS-CoV-2. Third, to enhance the tracing of the community spread in the city. And lastly, and especially after the initial pandemic has passed, to better enable public reporting of the prevalence of SARS-CoV-2 infections to support policy making and public understanding of the pandemic. So I will go to the next slide where I'll spend just a minute, but I want to push on. We went through a lot of thinking a few months ago and found out that we had these areas where we were not collecting data and would probably never ever test some people who passed away. You can take a look at that slide and look at the arrows pointing to no data. With this order, we hope to have eliminated the no data sources of testing and have all results eventually flowing to local and state databases. So the next slide goes on to how families actually comply with the decedent test order. How does that actually work for them? In all cases, whether it's COVID-19 or not, in general, for non-medical examiner instances, the family is going to contact a funeral home, and what they have to have ready is the name and the phone of the attending doctor. This is, in the medical examiner world where I come from, there are instances where the person actually has not seen a doctor for years and years, and often that case would go to the medical examiner. But in most cases, the funeral establishment would contact the DTU, and they would come out and perform the test if there was a test completed. Alternately, in about a quarter or fewer of the deaths in San Francisco, the medical examiner would be contacted, and they would determine whether it's a case that they're going to accept. If they do, they'll take the remains back to their facility and conduct this decedent test. If there is a religious reason why this must be done promptly, the family should notify the medical examiner. In some cases, I know the funeral establishments are familiar with this, and they do. And the medical examiner tries to expedite the testing and the release of the body as quickly as possible. So for families, it's very straightforward. They just have to have the medical information available and work with the funeral home, or in those rare cases where it's an accident or other case where the medical examiner is involved, they would work with the medical examiner, and there's almost always a funeral home involved, except in certain indigent cases, which is a little bit out of the scope of this talk. So for time reasons, I'm going to move on to the next slide. For all of you to get more reading, most of the documents are on the DPH site. I put on this slide www.sfdph.org, but it's actually not on their webpage. When you get to this initial page, you'll click on the coronavirus facts here section. That will take you to another page where you'll see health orders. And then when you click on that, the next slide, we'll show you this gray box, and it says postmortem testing, and that's important for navigation. To read the technical health order, you'd click on the blue postmortem testing, and you can read the pages there with the 13 points. The next document below is C1914, frequently asked questions for professionals, is aimed at funeral establishments and secondarily medical professionals. Families may want to know that level of detail, but I think for families who are uninvolved with the medical field, the frequently asked questions for families below that is the most useful, which talks about what is going on, why this has to happen, and why the order came out. It's in 6 languages, including English, as you see, and that's, Spanish is the only one that I can actually read outside of English. So I can tell you that that one looks pretty good. But that's a big effort by the Department of Health, considering that this order only affects people who pass away within San Francisco County. For those San Francisco residents who pass away in other counties or other jurisdictions, this order is not applicable. And that's really the gist of the order. In brief, I'm going to leave you with the next slide, which is just some links that I just covered in the DPH guidance for families, which I thought was the most useful stop. There's a San Francisco site about handling deceased persons. And for those of you who are interested in the 20 to 25% cases that are assumed by the medical examiner, there's a discussion of what happens during this process. So thank you very much, and I appreciate your attention to this talk about this subject.
Rand, thank you for this very comprehensive and informative presentation. I did want to remind those who are listening on that not only will a link to this recording, but all links to all of the resources that were referenced will be sent out by day's end today for your benefit, information, and use. We are very blessed to have joining us, Rand, 3 panelists, a clergyman and 2 representatives of the funeral-related services. These are really the ambassadors, I would say, who really are with the families and navigating them through these moments of grief. It's interesting that from the outset of the pandemic, almost immediately, the clergy in San Francisco pivoted to online services and virtual ministry. This is a case where virtual and online can be a challenge because, if anything, we want to be with our beloved, and grieve together in community. So we are going to receive today some insights on how the grief process happens vis-a-vis what you have shared with us and what they have observed in their own experiences since the pandemic has begun from 3 different faith traditions. We'll begin with Imam Abu Qadir Al-Amin. He is the resident Imam at the San Francisco Muslim Community Center. He has been a stalwart supporter of the Interfaith Council, was on early on with us, and we look to him right now to give us a perspective, a Muslim perspective on this very fragile issue.
Thank you very much, Michael. And good morning to everyone. As we say in the Islamic tradition, Assalamu alaikum, that is, may God's peace be upon you. I begin Bismillahir Rahmanir Rahim, seeking Allah's help and seeking always his mercy and his blessings. During this pandemic, Muslims, as other people of faith, have all been impacted by this pandemic and the kind of restrictions that it has placed upon us. Fortunately for us, we haven't had any COVID-related deaths in the San Francisco or Northern California area that I'm aware of. However, we have been impacted by deaths. Most recently, one of our imams who had been in hospice-like situation for over a year and a half in a coma-like state passed away. And then we had to deal with the family as well as prepare his body for internment, respecting the Islamic traditions established by our prophet. And one of the things that we do when we learn of a person's having deceased, we're reminded to say, Inna lillahi wa inna ilayhi raji'un. That is, our soul, our spirit comes from God, and it is returning to God. So we believe that this life, though we become attached to it, we don't believe that this life is the end. We believe that there's life after this life, and we pray for our loved ones, our deceased, our brothers, sisters, our family members, and we ask that God would have mercy on them and help them during this transition period. We also do the same thing when our female members pass. Most recently, a close friend of mine, his wife, passed away from not COVID-related circumstances, but from cancer. And we had to prepare her in the same manner that we prepare men. We wash the body, preferably believers and family members, if they choose so, can participate in that process. We have relationships with many funeral homes that permits us to come in and prepare our deceased according to Islamic traditions. In doing so with this particular person, this female, this past Monday, we buried her. We had to prepare her body. So the sisters came in and washed her body and shrouded her, similar to the way that Jesus Christ was shrouded. He was wrapped in simple white cloth. That's the tradition of the Muslims. And we interned the body with prayers. The Muslim prayers include us reciting particular prayers from the Holy Quran, but we also pray a prayer where Prophet Muhammad was asked, should there be a special prayer for him? He was asked this by his companions, and he was inspired to offer a prayer that is for all of the people of faith, not just for him, but for all of the followers of Abraham. We ask that God bless all of the followers of Abraham, that is the Jews and the Christians. And we also ask during this period for God to bless the followers of Muhammad. And we pray for our young ones, our old ones, those who are present, those who are absent, because in many cases, people who may want to be present to pray for a loved one, circumstances may prevent them from being present. So we want to, at this period with this pandemic, many funeral homes and even cemeteries, they restrict the numbers of people who can attend. So God in his wisdom had already given us a prescription for that, in that he acknowledged in our prayer that we pray for those who are present and those who are absent, because they may be absent because of reasons such as this pandemic, where circumstances just don't permit us to be present to offer our condolences, our love, and our respect for our deceased. So we're grateful to be a part of this conversation, and we are impacted as everyone else is, as citizens of this country. We want to respect the laws governing, protecting, and preserving the health and safety of all our community members. So again, Michael and the San Francisco Interfaith Council, we appreciate you for always including us in matters such as this, And we hope that our comments are helpful in reference to what we're discussing today. Thank you so much. God's
Thank
peace.
you, Imam. Did you have a question for Rand? And if so, this would be the time to ask it.
The only question that comes to mind is when a person has deceased from a non-COVID related disease, is the purpose of testing for COVID so that we can accurately track, and what's the purpose behind testing for someone who deceased from a non-COVID related illness?
Rand?
So as I understand the question, it is, what is the purpose of testing a person who's been deceased for a non-COVID illness? And that answer to that is that even though they may have passed away for another reason, for example, we did have somebody in San Francisco who was in an accident and was actually also COVID-19 positive, but they didn't have a lot of symptoms. So without testing that person, we wouldn't have known that the person's family members or 911 responders were exposed to somebody who had an active COVID disease. So it's very important for us to try to find out those cases, which we wouldn't have known, because there are actually, from our experience, many people who pass away from other causes, but yet have positive COVID in their system.
Thank you, Rand, and thank you, Imam, for that important question, and for the opportunity for Rand to share his response. Now we move to Dan Duggan, who is the co-owner of Duggan's Sarah Mortuary. Duggan Sarah certainly provides services, funeral-related services to people of all faiths, but you know, from the Christian perspective, a predominantly Christian clientele, we'll say. Dan, would you kind of give us some insights into what you're experiencing vis-a-vis the pandemic and the challenges that the mortuary is facing, and just some of the things that we need to be aware of at this point?
Be happy to. Good morning, everyone. I want to thank Michael Pappas and the San Francisco Interfaith Council for inviting me to be part of this briefing this morning. Just a little brief background about myself. I am a native San Franciscan. I graduated from Reardon High School, City College of San Francisco State University, and also, when it was still here, San Francisco College of Mortuary Science. I'm a licensed funeral director and embalmer, and I've worked at Duggan's Sarah Mortuary basically since high school, and I've been there for the last 47 years. I'm very proud to say that I'm the fourth generation in our family in the funeral service industry, serving families of San Francisco, and I'm very blessed. My two sons would be the fifth generation that work with me side by side every day. I wanted to share how COVID-19 has affected the families we serve and how we serve them. The greatest hardship of COVID-19 has been witnessing families whose loved one has died alone in a hospital or senior living facility. When death is close at hand, that is when family surrounds their loved one, typically. And we are not allowed at this time to hold their hand or be with them due to the COVID restrictions when they're in a hospital or a senior living facility. Even clergy are not allowed to give comfort with last rites or anointing of the sick or anointing of the dying at hospitals or assisted living facilities with COVID restrictions as well. So, you know, we hear stories about how, you know, it's very difficult for a 90-year-old mom or whatever to, a nurse trying to help them FaceTime their family, you know, when their death is near. And this is to me, it's the most heart-wrenching part of COVID-19. Another hardship on families has been the limit on the number of family and close friends that can attend a funeral service. At the beginning, beginning mid-March or so, at first families were limited to have 50 guests to be able to attend either a church service or a service at our facility. Then as the COVID-19 numbers escalated, the numbers went down to only 10 or 12 family members can attend. And this is very difficult. We serve a lot of the Hispanic community, the Filipino community, and a lot of these families have, 5, 6 children. And it's very difficult to say, okay, I have 5, 6 children, but only, 12 people can come. So we became very creative in trying to have split visitation times, or part of the family can come the evening before and the other part of the family can come the next day for another religious ceremony. So we tried to be very, very flexible so all immediate family can be there for their mom or dad's service. At the present time, all church services and funeral services must be held outdoors. Now, this is another big adjustment. You cannot have in San Francisco or San Mateo County now, you cannot have a church service indoors. So we have started to, and churches have started to adjust to be able to set up to have outdoor church services for funerals. And we have recently just erected, we have 3 tents, or we call them outdoor pavilions, that we have set up in the back of our facility. We're fortunate to have the room to do that. So we now have set up 4 outdoor event spaces for families to be able to gather, to still, be able to be with family, and we can still have a service outdoors. A big thing, as we're doing today, we offer live streaming on all our funeral services held at Duggins. We've also done some live streaming at services outside our facility. This past week, we had 2 outdoor church services for Father Jerry O'Rourke. And I believe Father Jerry was a longtime supporter and past participant of the San Francisco Interfaith Council. Father Jerry passed away at 95 years old, and over 1,000 people watched Father Jerry's live stream vigil service the night before, outdoors at St. Catherine's Church here in Burlingame, and another over 1,000 people watched his funeral mass, which was held outdoors as well. So we're adjusting to be doing outdoor services and still offer the live streaming so we can include those that cannot be there. We've had to be a little more structured when we're setting service dates and times, and even asking clergy if they could be more flexible. We're fortunate we have a fairly large facility. We actually have 6 indoor chapels, so we're eliminating our indoor facilities, and we're a little more limited outdoors. So we need the families and the clergy to be a little more flexible with us, so we can limit, if we have 2 services or 3 services in one day, we try to spread them out so we don't have too many attendees for the safety of everyone, too many people in our building at one time or outside our building with the outside services. We also, during this pandemic, we do have 3 reception rooms that we use regularly, where families are able to bring in food or have a caterer come in and serve their guests lunch or snacks or whatever. And we obviously, during this pandemic, we've had to shut down our reception rooms. Our limousines obviously have to sit idle during this pandemic. But we're so very blessed that we can continue to serve families with kindness and compassion during this time. And that's basically what we're seeing. We're all adjusting, but families seem very, very appreciative and of being able to offer, live streaming and still being able to have a gathering and where the family can get together, especially if they were not able to be with their loved one at the time of passing.
Thank you, Dan. Did you have a question for Rand?
Rand, I do want to say, for putting a program like this together in such a quick manner, I think you and your team did an amazing job. I spoke to 4 of my staff last evening that are more hands-on involved with home deaths and night calls and dealing with the Decedent Testing unit. And far and away, everyone was very appreciative and telling me in general, the transition has been very smooth. The only one concern that was brought up to me is sometimes we go into these senior living facilities or assisted living facilities, and there are still many facilities, even of this last week, Alma Via of San Francisco, and also the Jewish home, where when our staff arrived there and we asked if they had proof of testing, and the response I get is a lot of these facilities, and even some hospice workers are still kind of like deer in headlights. Now, what do you mean you need proof of testing? So I don't know if that's ongoing, if your staff is still reaching out to, these facilities, but there are some instances where that information is still not there yet. And it's kind of unclear about proof of testing. The facilities that are having a hard time of saying, well, we don't really have proof of testing to give you. So is that kind of ongoing, that you're still reaching out to the facilities and the hospice programs in San Francisco?
Thank you for your question, Dan. So proof of testing and outreach. Well, let me handle the easy one first. We are still reaching out to skilled nursing facilities. We did do a bit of outreach to hospices, and that is ongoing. Proof of testing was left very open in the health order, deliberately so, because it can be a wide variety of things. It could be the health professional looking up the medical record to see if there's a recent test, or looking through the paperwork, or some means. But they have to have some means of checking. If they don't, the funeral establishment really can just assume that a test needs to be done. Speaking for the medical examiner, for which I'm more hands-on and more familiar, what we train staff to do is, if a funeral establishment really needs that proof of test, they can call up a particular data entry screen that doesn't have a lot of other patient information, and the funeral establishment could actually take a picture. We discussed actually producing paper receipts. We thought that would actually be more than funeral establishments wanted to handle. But if it does turn into something that funeral establishments want, they should let us know. Thank you.
Great question, Dan, and thank you for your response, Rand. We are now moving to a Jewish perspective, and we're very blessed to have with us Sam Salkin from Sinai Memorial Chapel. In my time as director of the council, I've spent time at Sinai, and I know that for both the observant and the non-observant members of the Jewish community, that Sinai can almost be like a synagogue for them, and the role that the chapel plays in this transition period in people's lives is critical. So, Sam, would you enlighten us and give us some perspectives from the Jewish community?
Michael, thank you. Thank the Interfaith Council, Rushak, Sister Sonaria, Lynn, Rand, and Dan and Mir. We're honored to be here today. have a tremendous amount of respect for the work of the Interfaith Council, and particularly in these weekly seminars that you're doing around COVID-19. I'd like to talk briefly about the intersection of Jewish funeral and burial traditions and the public health crisis that surrounds us and that is part of us. Let me give you a short background on Sinai Memorial Chapel Chevra Kadisha. We are a religious, charitable, nonprofit institution that operates 3 funeral homes and 4 cemeteries. We are a very unique institution in American Jewish life because most funeral homes serving the Jewish community are for-profit, and the religious elements are handled by communal volunteers, not the funeral home itself. And we are the only Jewish funeral service between Los Angeles and Seattle. So while the Bay Area is our concentrated service area, we actually serve a very broad array of the West Coast. I also want to touch briefly on what the elements of Jewish religious preparation of the deceased are. And this is really Reader's Digest version. Our goal is to restore the body to the simplicity of the individual at birth. So we wash the body lovingly and carefully. We remove makeup. We give the equivalent of a manicure, pedicure. If there are wounds, we sew them up. And the deceased is then wrapped in a simple linen garment. There is a liturgy that's a recitation of psalms and ancient prayers. And in our tradition, we watch over the deceased from the time of their passing to burial with the recitation of psalms to provide comfort to the discombobulated soul that hovers, having been separated from its vessel, the body. Jewish funerals are communal affairs. They begin with burial in ground in a simple casket, all wood, no metal. They're highly communal and participatory, ranging from shoveling in the grave, the greeting of the deceased family next of kin, the fact that traditionally the prayer for the deceased Kaddish requires 10 people to be present, and in very Orthodox tradition, only 10 men, which comes up against what Dan mentioned about 12 people, and having to figure out how to have sometimes 10 men, but not necessarily, and also more than 10 people. There are also the tradition of immediately after the funeral, having a meal of condolence that is served by friends. That's not a catered affair, but is a communal affair. And then for the 7 days following the funeral, Shiva, the Hebrew word for the number 7, where morning and evening there are prayer services in the home of either the deceased or the next of kin. The confluence of the pandemic. The confluence of the pandemic turned everything we do upside down. The first thing we did was we prepared for a tsunami of death, because this was, I'll take you back to March, third and fourth week of March of this year in New York City, where what we were seeing before our eyes was horrific. And it was hard to know whether we were going to face that here or not, but we had to be prepared. So I won't go into the details of preparation, but we were prepared for the tsunami that never occurred. We totally changed virtually everything we do. The care for the deceased and the comforting of families is our #1 priority. And we had to make that a secondary priority. We said to ourselves, that our #1 priority has to be the health and safety of our staff, because we're the only Jewish funeral home between Los Angeles and Seattle. If our staff got infected, we couldn't serve our community. I'll talk about that a little more. In addition, we had to begin to do all arrangements, both advanced plans as well as at need, remotely. If you would ask, I would say, if I had said to my staff of funeral directors a year ago, I've decided that we're going to no longer do face-to-face arrangements. We're going to do them all over the telephone. We're going to use email and FaceTime or Zoom. People would have resigned. people would have said, that's not why we came into funeral service. We're here to connect and have a relationship with families. And today people have been forced, but also have agreeably embraced remote arrangements. We allow no outsiders into our facility. Our assumption is that everyone is a carrier of the virus. It's pesky. We don't really know as much about it as we should. And so whether it's the casket delivery person or the FedEx person or outside communal religious staff or clergy, we allow no one in our staff except our own staff. We've changed our staff configuration so that we operate in 2 pods, so that if, God forbid, one person got infected, we have a full team, and that team had to be quarantined for 14 days. We have a second team that can back them up. The preparation of washing the deceased, tahara, has changed because we're not using any water in our facility because of the droplets that could be associated with infecting the people who do the work. And our burial traditions have been modified with shoveling, social distancing, and what is generally a very intimate event, no longer an intimate or fundamentally communal event. And finally, one of the services we offer that's different than most funeral homes is we have 4 mourner care counselors on our team who provide no-cost mourner care and bereavement services to the families of the deceased we serve. And today, all of that mourner care counseling is being done remotely over telephone, Zoom, FaceTime. And again, not still providing the service, but not with the same touch, not with the same intimacy.
Thank you. Now, would you like to pose a question to Rand?
No, just a compliment. My compliment is that when the city county announced that this was going to be happening, a number of colleagues in the funeral industry were aghast. We were not. We welcomed it. And while these things are very complicated, we think that Rand and his colleagues are doing a commendable job under very, very challenging circumstances.
Thank you so much. And thank you to all of our faith panelists. Had time permitted, I have a number of questions I would have loved to have asked each of you. One of the things that in my conversations with our faith leaders is the many lessons that they have learned over the course of the pandemic and dimensions of ministry that they never thought possible. And so I suspect that as at some point we will emerge, we will be a different people, at times will be different, but I suspect that there are many lessons that you all have learned on this journey that will help you in terms of your ministry to the families at such a critical time. So I say thank you to each of you, Imam Abu Qadir Al-Amin, Dan Duggan, and Sam Salkin. And Rand, thank you so much for the gift of time that you have given us and the insights of things that are going on behind the scenes that we really do need to know about. So thank you for your generosity of both expertise and time that you've contributed today. To dear Kaushik, the chairman of the board of the Interfaith Council, and Sister Sukanya, we thank you. Thank yous are also extended to SFIC program administrative associate Cynthia Zambucas, who has done a lot of the work to help produce this program behind the scenes, as well as the COVID Command Center's Joint Information Center virtual outreach team. We thank coordinator John McKnight and our producer Lynn Mays, assisted by Sharon Walton and Christine Salai and Huey Lee. Thank you all for the collective effort of being able to produce the rich content and the program that we've enjoyed today. We're going to ask that you come back next week and join us as we address the challenges and the opportunities of volunteering during the COVID-19. And we have a wonderful lineup, and we look forward to seeing you this time next week. This concludes our program for the day. God bless you and God keep you.